Why do we recommend orthotics to all of our patients that come in, you guys? So orthotics are super important. People don't realize that 25% of the bones in our whole body are in our feet, actually. So just picture this. I'm going to show you a little demonstration here. Imagine we have the arch of our foot right here. That's important to have that, actually. Structurally, it supports everything above that, which is our whole body, right? So imagine if that just drops down about 2 millimeters. Well, what does every joint above that arch start to do? It starts to compensate. Literally, your ankles affected, your knees affected, your hips, your lower back, all the way up through your neck. So if 25% of the bones in my body are in my feet, there's a very specific position we all need to be in for that to be structurally sound, okay? And a lot of people also don't realize there's not just one arch right here, but there should be an arch in our toes. This is very important. Our patients that come in that have gotten orthotics from over the counter or through a prescription through their podiatrist, a lot of them throw those away for the ones that we use. These actually come out of Canada. I've used these for over a decade with people, and they are by far the best ones we've ever found, okay? So back to the arch. This arch is very important. We all have this arch. When that arch drops, it can develop, into low back issues, plantar fasciitis, all these different issues that come along with that dropping of our arch. Well, again, there's a second arch, which most orthotics just don't support. So there should be an arch in our toes here, where there's a slight arch that lifts up our foot. So there should be an arch in the toes. There's also a second arch that we all know about, okay? So 25% of the bones are in this area. They have to be in a certain position for everything above to be structurally sound again, okay? When I see other people's orthotics, they're just kind of strange. Understand what your foot does, right? It's designed to move, it's designed to walk, literally take on all the pressure of our upper body every step of every day. Honestly, in most people's opinions, everybody needs an orthotic to support your structure. I don't know how many people come in now with plantar fasciitis and knee issues, and sometimes when we just put them in one of these orthotics, those issues start to fix themselves because we're fixing the foundation, which everything is supported upon, right? These are not stiff like a lot of orthotics on the market. If I just put you in basically a plaster cast, right? Our foot's designed to move. It's designed to move in a certain way every step that we create, every step of every day, thousands of steps per day. So if it's stiff and rigid, you're not gonna have motion in the foot. That's not good either. So I also don't wanna put you in a super hard plastic one because it's uncomfortable, right? These are flexible, these are also supportive, but they also have a thick pad to help create more of a softness, more of a compression prevention in the foot itself. So here's the process. When you come in to get custom orthotics in our office, which are the best ones we've ever found, first we have to scan your foot. You're gonna do a static scan where we have you standing on the platform. It's gonna measure your foot and the pressure and the weight distribution of that foot as you're standing, but that's only half the information. The second part of the scan is gonna be a dynamic scan where we literally have you walk across this digital platform that's gonna measure the exact biomechanics and the pressure points through the foot, through your gait, with each step on your left and right foot. So it's gonna map the foot pressure for us, okay? Then this information basically gets sent to Canada digitally. They create a custom orthotic for us, for you, that's literally customized based on your foot, your weight distribution, and your patterns of gait, and it gets sent to us usually within 2 to 3 weeks, okay? So once that data gets to the lab, they literally start creating it there. It's not a pre-made orthotic. That's not good. Again, 25% of the bones in my body are actually in my feet, so there's a very unique fingerprint that has to happen in each and every one of us. Even though it's similar, it's very different based on those patterns that we scan on your particular body. That's why they're 100% custom every time we do this for every patient. They're not sitting on a shelf and then we call them custom and grab one of the maybe 5 to 10 different ones that we try to, cookie cutter into everybody. So we hope you enjoy these. I have 5 pairs now. I keep them in all my shoes. This is a very important thing. If I don't wear them over, let's say, a weekend, if I start walking around my house barefoot or I have flip-flops on over the weekend, I literally start to feel my ankle become uncomfortable. I start to feel my knee out of balance a little bit. I've had lots of little injuries on my ankles and knees over the years, so I feel them. So I don't really feel when I have them on anymore because they're comfortable and they're great for me. However, I do feel when I'm not wearing them because I've created that pattern, which takes many months and years to develop. Most of us come in with an abnormal pattern. That's why we have the foot pain, the plantar fasciitis, the knee issues, the hip issues, the neck issues. We want to create that new, better pattern, right? Our health is really patterns and habits. So if I have 10,000 steps a day on my foot in an abnormal or non-custom orthotic or a shoe that doesn't fit me very well, well, that's not good either. So the cool thing about these is these orthotics go in and out of all of your favorite closed-toe shoes so that we can support your gait, your structure with every step, no matter what pair of shoes you have, as long as it's closed-toed shoes. Thank you.